Hello, everyone. Welcome back to our assessment for batch 2 of our CAA aspirants. And we are now on pattern differentiation according to the 8 extraordinary vessels. So we shall start our questions with, we shall start answering the questions with Dr. Angeli Templo from Cagayan de Oro. Good afternoon, Doctora.
Good afternoon, Doc. Good afternoon, everyone.
Can you tell us the signs and symptoms that would be present if the governing vessel or the two meridian is involved
Yeah,
internally?
internally. So there's epilepsy, back spasms, convulsions, hemorrhoids, enuresis, infertility, positional headache, with ano to doc, plus or minus
Yeah,
heaviness.
there can be heaviness or there can be no heaviness. So
Uh,
there may be dampness or wala, no? Very good. So this is basically the back symptoms, no? And we all know that these are very young siya. So that means there is some young characteristic here. May pain, mayroong, hemorrhoids, episotonus. I'm sure you're familiar with episotonus and of course headache, no? Very good. Let's go to the musculoskeletal symptoms that involve your due meridian or governing vessel. Musculoskeletal lang.
okay, so there's stiffness, pain, or spasms along the spinal column.
So very easy. So all you have to do is look at the location of your or the path of your do, no? So the pathway would be like going up, diba? Mm. So when you try to relieve the symptoms, you have to go down. You have to sedate it, diba? You have to remove it. Next. Let's now go to the conception vessel or the Ren meridian. What are the signs and symptoms internally?
There's leukorrhea, irregular menses, male and female infertility, nocturnal emissions, enuresis, hernia, retention of urine.
Very good. So when it comes to infertility, both male and female, you should always take a look at the Ren meridian, or you have to use points in the Ren meridian or the conception vessel. What about the musculoskeletal aspect?
There's pain in the genital region.
Okay, very good. Next. Now let's go to another extraordinary vessel called the Chung vessel or the penetrating vessel.
Yes.
So what are the signs and symptoms internally? The symptoms, rather.
Yeah. There will be irregular menses, male and female infertility, miscarriage, and difficulty of breathing.
Okay, very good. So for infertility or fertility issues, you have to always consider the conception vessel and the penetrating or chung, diba? And when you have a miscarriages, history of miscarriages, then you have to always take a look at the penetrating vessel. Okay, difficulty breathing. So this is your penetrating vessel. Okay, what about the musculoskeletal aspect of the chung?
There will be pain in the chest and abdomen.
So these things you have to elicit from the patient, diba? Especially if the chung is involved. So if you have a patient, I always ask, like there was, I have like last week, I have a female patient who wanted to give, who wanted to, because of history is miscarriages. So I would always ask for pain issues in the chest and abdomen. So particularly the path that is traversed by the chung. Now let's go to the belt meridian or the girdling or the tai mai. What are the symptoms internally?
There will also be irregular menses, leukorrhea, abdominal distension and fullness, uterine prolapse, muscular atrophy.
So it is called the girdling or the belt. So you should have issues sa belt. So this is actually the only extraordinary vessel that has a belt configuration, no? And they have no points, unlike the conception and the Ren. Now let's go to the musculoskeletal aspect of the Dai Mai, or the girdling vessel, or the belt meridian.
Yeah. There will be weakness with or without pain around the umbilicus and lumbar spine.
Very good. So it's easy, no? So it's just like wearing a belt. So it extends to the spine, lumbar. Excuse me. Now let's go to the Yang Chao Mai, which is also called the Yang heel vessel,
Motility.
no? Or the motility. Okay, let's talk about the internal symptoms.
There's epilepsy, mania, hyperactive yang, difficulty falling asleep, insomnia, and insanity.
So if you have people with mental issues who are about to lose their mind, you might want to consider treating the Yang Chao. Okay. Next, the musculoskeletal aspect of the Yang Chao.
There's pain in the inner canthus and lumbar spine,
Yeah.
eversion of the foot,
Yes.
tightness with or without spasms in the muscles along the lateral side of the legs, weakness on the medial side of the legs.
Okay. Eversion means going out. So that's very Yang heel, Yang Chao. Eversion, no? And there will be pain in the inner canthus or the medial canthus in dito and the lumbar spine. Next, let's go to the Yin Chao Mai, which is the yin version of the Yang Chao Mai, or the yin heel. So
Yeah.
it's something to do with this area. So what are the internal symptoms, Doctora?
Epilepsy, lethargy, schizophrenia, excess yin, and coldness.
Very good. So schizophrenia. Oh,
Schizophrenia.
we might want to consider that in people showing signs of schizophrenia. Next, musculoskeletal aspect of the yin chow motility vessel. Motility, kasi gumagalaw, no? It's the paa, no? The heel rather. So if yang chow is eversion, this one will be the opposite. So you may have
Inversion.
medyo parang natatapilok, no? Papaloob. I don't know if you can repeat this.
Yes po.
Yeah. What are the...
So, there's inversion of the foot, coldness in the lower limbs, tightness with or without spasm in the muscles along the medial side of the legs, weakness on the lateral side of legs.
Okay, so if the medial side is strong or in excess, the opposite, the lateral side would be weak. Okay? Now let's go to the yang way or the yang linking vessel. Internal symptoms.
There's weakness and limpness of body together with insecurity and mental disturbance. When the yin and yang, Wei Mai, cannot maintain their respective ties, one feels uncomfortable and loses one's will. Okay. Furthermore, one is flaccid and cannot support one's stature, according to Nanji.
Okay. So this is something to do with mental issues, no? The yang way.
Mental.
Okay. So it's all about connecting, linking. What about the musculoskeletal aspect of the yang way or yang linking vessel? It actually links the yang. If you take a look at the points, no? Puro yang yan. Make sense? So
yeah. Yes.
What are the musculoskeletal symptoms?
There will be intermittent fevers and alternating fevers and chills and pain in the lateral side of the body.
Okay. Now let's go ahead to yin wei naman. Yin wei linking vessel internal symptoms. So some of you may find this very relatable, as you will find out later on. Doctora.
Yes, There's blood and or yin deficiency, especially if accompanied by psychological hmm,
Signs, yeah.
such a signs such as anxiety, restlessness, insomnia, and this calms the mind and cause broken heart
Yes.
signs.
So brokenheartedness, you might want to take a look at the yin way, no? Next, musculoskeletal aspect.
There will be chest tightness or pain. So there's cardiac discomfort, blood deficiency, there's headache at back of neck.
Okay, it's a headache due to blood deficiency, no? It's very dull. Sometimes you wouldn't, you cannot imagine why you're experiencing it. Now let's look at para mag-retro tayo. Can you tell us more about the 8 extraordinary vessels and why they are called such? Why they are always discussed separately?
Most branch of the 12 primary channels, there's only two, the Dumai and Renmai have points on their own. The remaining 6 share acupuncture points with the primary channels that do not pertain to specific organs.
So only two, the Tumai and the Renmai, they have points of their own. So the others you will have to, because they branch off the 12 primary channels, so you would expect to use the points associated with these channels. So they do not pertain to specific organs. Kaya tawag sa kanila extraordinary vessels. What are their functions?
Um, Reservoir of energy. It stores excess of qi and blood from the primary channels. It releases qi and blood when primary channel is deficient.
Mhm.
It also integrates primary channels as it facilitates interaction among the primary channels. It circulates Jing and Yu1 from kidney, which it derives energy from kidney and contain essence from kidney. It takes kidney energy all over the body. It regulates life cycle, energy to 5 curious organs like the brain, spinal cord, uterus, gallbladder, and blood vessels. And lastly, it distributes Wei Qi over abdomen, thorax, and back.
So this serves as the backup, no? Just like your data sa computer, you should always have backup. Get it?
Mhm. Yes,
So you
Doc.
need to actually have reserves. And if you notice,
Reserves.
if you take a look at this one, it circulates the Jing and Yuan from the kidney. So the kidney has a lot to do with it, no? So while you are still young, you need to be able to already keep the EOVs, the extraordinary vessels, at their optimal
Mhm.
function. Next.
Mhm.
What are the Western function associations? So that means we're talking about the Western concept of, or like, how is it related to the organs in Western medicine?
In Western function, it's related to hormonal control, nervous control, controls musculoskeletal system, genitalia, circulatory, hepatic, and biliary.
Okay, so now you know. What are the applications of the 8 EOVs? Let's call it EOV.
Yeah. Symptomatology is a composite of the primary channels that each extra channel joins, multiplicity of symptoms that don't fit into a Zhangfu with the 8 principles or primary channel pattern. It's chronic, long-term illness, endocrine problems, psychological imbalances when you have tried everything else.
So in short, this is the last resort.
Mm-hmm.
Interesting, di ba? So when you have tried everything, you don't know what is happening already, you don't seem to find any improvement in the patient, you don't know what your diagnosis is, parang trial and error. time to actually look at the EOVs.
EOV na.
Okay na.
Yes po.
Multiplicity
EOV.
of symptoms. They don't fit into what particular Zangfu is involved. Okay?
Mhm.
Next. Let's go to the pairing technique. So they always come in pairs, no? So can you tell us about the pairings?
Yeah. For Du Mai, it's the Yang Xiao Mai. For Ten Mai, it's the Yin Kai Mai. For Chong Mai, it's the Yin Wei Mai. And Dai Mai, it's the Yang Hui Mai.
Okay, sorry for the ano ha, that's Ren Mai. Ren Mai,
Ren
Yin
Mai.
Chao Mai. So that means the Du Mai or the governing vessel will pair with the Yang Chao or the Yang Heel. Okay?
Uh-huh.
And the Ren Mai will pair with the Yin Chao Mai or the Yin Heel.
Yin.
The Chong Mai,
Yin.
so that means Chong is Yin. It will always pair with its kapwa na Yin. Yin Wei Mai or Yin Ling
Mhm.
King. The Tai Mai is Yang, will pair with the Yang Wei Mai. So let's talk about the master points and the couple points technique.
Um, First, it activate extra channel to the SI3 GB62 Yang Xiao Mai. For the Ren Mai Lang 7 Kidney 6 as Yen Xiao Mai. Xiong Mai Spleen 4 PC 6 as for the Yen Wei Mai. And for the Dai Mai GB41 Sanja 5 Yang Wei Mai.
We have some typographical errors. This is UB62, bladder 62,
Ayun.
SI3 and bladder 62. Okay. So
UB62.
I always use this for like you've tried this on patients already. You've tried other points, but the shoulder point doesn't seem to go, or anything related to the back, like the back pain, low back pain. So you would use Dumai. That's pairing with the Yang Chao Mai. Okay, so they
Yeah.
share these points. So which means that if you're going to needle both SI3 and bladder 62, that's bladder, that's not GB, UB. Sorry for the
Yes, Doc.
typographical error. That's bladder 62. There's no such thing as GB 62. Bladder 62. So for women, you always start with the right. You needle the SI3, then for the left, you needle bladder 62. So that means you will not only treat the Dumai, you will also treat the Yang Chao Mai. So if you remember, the Yang Chao Mai has something to do with the, of course, when you have been uh, having issues with your back, it's probably related to your mental issues already, no?
Mhm.
Okay, so it's very hard to explain, but that usually happens. So for Renmai, if you have issues with the front, so you always combine it with Yin Chao Mai or your Yin Heel vessel. So lung 7 and kidney 6. You start with lung 7 and then kidney 6. So if it's more of a mental issue, you start with kidney 6 and then lung 7. Chong Mai is paired with Yin Wei Mai. So it's always Yin. So spleen 4, uh, on the right, pericardium 6 on the left. And then finally, we have the Daimai, GB41, and then Sanjiao 5. So please take note of these points. Okay. And when you take out the needles, they are in reverse order. So it's like first in, last out. Are we clear?
First in, last out.
Yes. So if you're quite
Yes, Doc.
sure about using these points, because you have also observed some mental issues, no, and you're very confident that you got the diagnosis, then you have to follow the how they do it. But don't ask me why it should be like that. Okay. So let's talk about
Mhm.
the Chinese method of needling the master points and the coupled points.
Master for the Chinese method, master point on both sides and couple point on both sides.
So it's up to you. I don't know why they are in conflict with the European method. So let's follow the Chinese.
Mm-hmm.
Okay. Master point on both sides, so bilateral, and also coupled point on the
Bilateral.
bilateral. For the European method, this was what I was talking about. Can you tell us more about it?
Master point on one side, left for men and right for women, and the couple point on the opposite side, left for women and right for men.
Okay, that's it. So no questions asked. If you like Europe, then you do this. Machocha
On one
is
side.
European, no? Giovanni Machocha. So he is
Uh,
Italian, Portuguese, Italian yata. And then so Giovanni Machocha, no? So he would follow this one. So if you like Chinese, and then you follow
then bilateral.
bilateral. Now, how long are you going to retain the needles?
15 to 30 minutes po.
Very good. And how do you remove the needles?
In reverse order and be conscious of the level of intention.
Okay, you should always be confident with what you're doing, and you should always know what you want to do with the patient. So it's not all about you have to always put a lot of effort in trying to make your patient improve. Okay? Ganun lang po. Reverse order. Next, can you tell us more about the tumai? What is another name for dumai?
Governing vessel.
Very good. And the dumai is paired with what EOV?
The yang xiaomai.
Very good. What's another name for yang chow mai?
Yang xiaomai.
Yang heel vessel, no?
Yeah. Kanina.
Or
Yang
the
heels.
young motility vessel. Motility, lumalakad, di ba? Ito na yung natatapilok, you tend to invert your food. I don't know if, Okay. What is the tumai master point or master point with the tumai?
SI3.
Okay, that's SI3. So if you have a patient who's always complaining, like always in front of the computer because of the posture, naka-slouch, you might want to use
Mm-hmm.
SI3. And you combine it
Mm-hmm.
with
UB62.
very good, bladder 62. Any questions, Dr. Janine? It's easy, no? So if you pro-Chinese,
Basic, parang alam ko na kung sinong gagawin.
actually, I find it easier with the Chinese kasi sometimes you tend to forget that. I don't know why they are in conflict, no? So our source, si Machocha, wanted it bladder, pag lalaki, unahin mo yung SI3 sa left. Bladder. It's up to you. Okay, siguro, it doesn't make a lot of difference. Okay, so if you're going to impact the dumai, the governing vessel is always the back. Back yun eh. All about the likod, no? Because most likely the patient will not only complain of upper back pain, some will complain of even the low back or even the entire back, diba? Next, what are the functions of dumai, Doctora?
It governs the yang channels and qi of the whole body, the qi of yang. It regulates yuan qi via kidney. It nourishes brain and spinal cord via kidney connection. And the kidney is in charge of marrow. Brain is the qi of marrow. It controls the central nervous system and it circulates wei qi over back.
So in the exam, if we ask you, what is the C of yang? So it should be dumai. What is the C of the C of maro? It's the brain. Okay? So it actually governs the yang channels and the chi of the whole body. Now, if the patient is in pain, you will always be talking about stagnation of chi or more of the yang, diba? So SI3 and bladder 62, in my experience, really works. Okay? Next, what are the symptoms of the dumai? Or what are, like, when do we use SI3 and bladder 62 for?
When there's stiff spine, headache, eye pain due to overactive yang qi, Um, Young in spine, heavy head, sagging shoulders, shaking as in Parkinsonism, deficiency, young, chi in head and shoulders, mental disorders as in bipolar,
Mm.
rheumatic conditions, there's inflammation in the joints, hemorrhoids, sterility, hernias, enuresis,
Okay.
heart pains, colic, constipation, and fever.
Okay, so basically, ito dito ha, this is excess yang in the spine. Di ba pag excess yang, there's pain. So, um, if you're not nagtitipid sa needle, you might as well needle it na lang. No? You can do it bilaterally or one after the other. SI3 bladder 62. Believe me, it works. It's like
Just
um
say for the
it's not an
patients.
overkill, but you may also want to do it on the ear. Okay, so when you
Mhm.
have stiff spine, headache, eye pain due to overactive yang qi, di ba? You have so many things to do, you have so many things to read, and so there's excess yang in the spine, heavy head, sagging shoulders, Parkinson's, you know Parkinson's, di ba?
Shit.
Deficient yang qi in the head and shoulders, bipolar, okay, bipolar, inflammation in the joints, but this is very senior.
Mhm.
Hemorrhoids, sterility, hernia, enuresis, heart pain, colic, constipation, and fevers. So can you tell us the pathways and points for the Dumai?
The main pathway originates internally in pelvic cavity, internally via REN1 to DO1 externally, up the spine to DO16. The internal branch takes from DO16 up over the head to the vertex and follows to the maxillary gum line. All other pathways are internal. All other pathways are internal. First begins internally in lower abdomen, follows to genitals, winds around anus, then it ascends along the interior spinal column until the kidney level, where it bifurcates and enters each kidney separately.
Okay, so that's the governing vessel pathway. So let's continue with that. It also begins internally in the lower abdomen. It follows to the genitals, as you can see here. And then it ascends along the anterior midline, passes through the heart. Yun. So basically, it has three pathways, internal pathways. It can begin at bladder 1 here, and then bilaterally, it goes to your DO20, and then at DO20, it enters the brain. Then at DO16, dito sa likod, it will exit the brain, bifurcates, and parallels the bladder channel. So you see how powerful it is. Okay? With regards to the points, can you tell us how many points does the Dumai have?
Um, it starts from DO1 to DO28.
Okay, very good. Next, Dumai is also known as
Governing vessel,
Renmai is
conception vessel,
good. Chongmai is
penetrating vessel, the sea of blood.
okay. Sea of Yang is
Sea of Yang. Nawawala na ako doon.
ay nako, ano ba yan? Sea of Blood is Chongmai.
Chiang Mai.
Kai Mai is
Belt, girdling vessel.
yes. Yang Chao Mai is
Yang heel, motility vessel.
and Yin Chao Mai is
Yen heel, motility vessel.
okay. You just read through this. I don't think you might be so interested. What is important is you know about the channel. Next, let's talk about the Yang Wei Mai or the Yang Linking regulating vessel. What is another name for this, Yang Wei Mai?
Yang linking, regulating vessel.
Yin Wei Mai?
It's a yin linking regulating vessel.
Yang Chao Mai.
It's yang heel, motility, or mobility vessel.
Yes. And the Yin Chao Mai. Who is the
Yang.
excuse me, the couple, the partner of Yang Chao Mai?
Dumai.
Tu Mai. Very good. What is the master point of Yang Chao Mai?
Bladder 62.
Okay. So if we're talking about the Tu Mai, it should be SI3. But if you're talking about the Yang Chao Mai, it should be bladder 62.
Uh-huh.
So what is the coupled point of the Yang Chao Mai?
SI3.
Very good. What is the Shi cleft point for Yang Chao Mai?
Bladder 59.
Good. So I'm sure you are familiar with Shi cleft point, diba? There's pain, there's congestion, diba? So Shi cleft point for the Yang Chao Mai is bladder 59. And Yang Chao Mai balances with what channel?
Yin Shao Mai.
Very good. Parang Chao Mai.
Shao
Yang Chao
Mai.
Mai is regarded as
As a branch of the bladder channel.
very good. What are the functions of Yang Chao Mai?
It brings yang energy to the eyes. It helps maintain muscle tone in legs. About and absorbs yang or stagnation in the head. It expels external wind, harmonizes left and right sides of body. That's important for walking.
Yung mga balancing, no? Helps maintain. It absorbs excess yang in the head. No, yung stagnate, mabigat ang ulo. Yang Chao Mai. Sometimes you just have to do a lot of walking. Mawawala yan. So Yang Chao Mai. What are the symptoms for Yang Chao Mai?
Eyes are not closed. That is insomnia. If
Excess.
I don't know, excess, lateral leg muscle tightness, medial flaccid, foot eversion for women and inversion for men. There's daytime epilepsy, stroke, facial paralysis, wind, FEI with headache and stiff
Stiff
neck,
neck.
low back pain, extreme
With
nervous tension, a structural imbalance between left and right sides of the body.
Okay, very good. We'll try to modify this para hindi kayo malito. Maraming errors. Next, let's talk about the pathway for the Yang Chao Mai. Where does it begin?
It begins at lateral malleolus, runs up the lateral side of lower extremity and trunk to posterior lateral shoulder, neck, then anteromedially via cheek, inner canthus of up overhead to GB20 and enters brain at DU16.
Very good. That's the Yang Chao Mai. So madaling mag-evert yung paa. What are the points involved in Yang Chao Mai?
Bladder 62, 61, 59, Sanjiao 10, LI 16 and 15, stomach 4, 3, 1, bladder 1, GB 20, and DU 16.
Okay, did you memorize that?
Hirap daw, dami.
Now let's go to Dumai. The Dumai and Yang Chao Mai pairing. Okay, if you use both Dumai and Yang Chao Mai, what will they affect?
It affects the posterior aspect of lower extremities, back, spine, neck, head, eyes, brain in their entirety.
Okay,
Spasms, contractions, articulation.
Yes.
Yeah.
So this time you will notice you involve the lower extremities already because you have the pairing of the Yang Chao Mai with the Dumai. Do you follow? Pag Dumai, sa likod lang. So, yun.
Yes, Dumai at the back.
Renmai.
It's the conception vessel.
Renmai is paired with what?
Yan Xiang Mai.
Yes. And the master point for Renmai is?
Lang 7.
Very good. Coupled point of Renmai is?
Kidney 6.
Functions of Renmai.
First, it controls all yin channels in body as the sea of yin meridians directs yin energy, controls life cycles. Second, it nourishes the uterus, regulates menstruation and reproduction. It governs fetus. It spreads qi to abdomen and chest, inside to internal. It controls body fluids in abdomen. It circulates yin qi, including blood, essence, and body fluids. It controls the yin meridians, particularly in the lower abdomen. It activates and moves qi in lower jiao, regulates the internal organs, absorbs yin meridian excess, particularly stagnant qi and blood. It distributes yin qi upward to face and eyes and to the triple burn.
Very good. Let's now go to the symptoms of Renmai. When do you use Renmai?
When there's congested qi, catar, catar plumpit,
Yeah.
menstrual irregularities,
Hmm.
miscarriage, infertility, leukorrhea, menopause, GI, gastrointestinal disorders, especially those involving mucous membrane, ulcers, diverticulitis, eczema, acne, yang pathogenic activity as in dampness, cold, blood stasis, and phlegm.
Okay, thank you very much, Doktora. Nakalampas na pala tayo. Nag-60 na tayo. Thank you
Thank
so
you, Doc.
much. Bambawi po yan. So sana pumasok lahat, ha? Okay. Let's now call on Sir
Thank you, Doc.
Victor Ginto. Sir Victor, gising pa.
Yes, Doc.
Okay.
Yes, Doc.
Excite ba kayo sa EOV natin? Extraordinary Vessels? Or are you
Yes po, lagi.
Oo, nandyan lahat, di ba? Just
Opo.
like what Doktora mentioned here. So when you have a patient who's always having
Bye.
miscarriages, infertility, you might want to consider treating the Renmai, no? So
Yes,
sino
yes.
partner po ni Renmai?
Renmai, Chong Mai,
Anong Chong Mai? Yin Chao Man.
Yin Chao Mai. Yin Chao
Oo,
Mai.
Yin
Oh.
Chao Mai. Tingnan nyo, maganda for eczema, acne, yung pathogenic activity, dampness, cold blood stasis. Ang daming may ganyan na. Yun. Renmai, the pathway, Sir Victor of ano. Then we will call on Ma'am Erdeles Gonzaga for siguro 91 to 100 up. Okay. Pathway po ng Renmai.
Pathway, it originates in pelvis cavity, the uterus in females, lower abdomen in men, and becomes external at REN 1. At
Okay.
REN 1, it ascends along the anterior midline line and ends at REN 24.
Okay.
At REN 24, there is an internal part of the channel that encircles the mouth, connects with Dumai at Du 28, and ends interior to the eyes at stomach 1. An internal branch originates in pelvic cavity, goes down to perineum and up the spine posteriorly to upper back.
Very good. Perfect. So yan lang po ang Renmai, no? Mga branching. Okay, can you talk about the points? Ilang points meron ang Renmai?
Maraming points. REN 1 to 24.
Okay.
According to some sources, Do 28 also ST1 are Renmai points.
Other books will tell us from Do 28 to Stomach 1. Next.
Yeah.
Let's talk about the partner of Renmai, Yin Chao Mai or Yin Heal. What do you call this? But more commonly.
Yin Heal Motility Vessel.
Okay. Yin Chao Mai is paired with
Renmai.
What is the Yin Chao Mai master point?
Kidney 6.
Yin Chao Mai coupled point.
Lung 7.
Shi cleft point of Yin Chao Mai.
Kidney 8.
Shi cleft point of Yang Chao Mai. Wala na.
Kidney 8 yung she cleft point.
Ng Yin Chao Mai. My next question
Yin Chao-
is, Shi cleft point ng Yang Chao Mai.
Yang Chao
Equivalent.
Mai. Yung
Other, ano, dapat Yang din, di ba? Yang Chao Mai. Of course, alam
Yeah.
natin, Yin Chao Mai, Shi cleft point is kidney 8. What
mm,
about the Yang Chao Mai, Shi cleft point? We mentioned that earlier.
Yung ba yung bladder 62?
Di oh,
Ay,
not a Shi cleft point. Di ba yun yung ano, SI3 bladder 62? The Shi cleft is, of Yang Chao Mai is bladder 59. Di ba?
59.
Try to visualize where it is located. Kidney 8. Okay, kung napapansin nyo, para magkabilaan lang siya.
Sa
Next.
likod. Oh.
Yin Chao Mai is regarded as the branch of,
Kidney channel.
yes. What are the general functions of Yin Chao Mai?
It regulates the opening and closing of the eyes, balance yin yang qi in lower extremities, regulate the function of the brain, help lift energy to the head, brings yin energy to eyes, treats atrophy syndrome, treats lower abdominal pain, and regulates urinary problems.
Good. General symptoms of Yin Chao Mai.
For the visual symptoms, differences in tension between medial and lateral aspects of the legs.
Okay.
Across the board, differences between yin, deep, and yang, superficial pulse depths, difficulty walking or standing, epilepsy, eyes stay open, somnolence, spiritlessness, lassitude, apathy, spasm of the medial aspect of the lower extremities, inversion of the foot, urinary difficulty, lateral abdominal pain, or abdominal abscess.
Did you get all that? The eyes remain open.
Hindi makatulog yan.
Di makatulog. So isasara mo. Let's talk about the pathway of the Yin Chao Mai, partner ni Ren Mai.
It begins at the medial malleolus,
Okay.
up the medial aspect of the lower extremity towards the genitals,
Yes.
up in chest, neck, cheek to the inner canthus of the eye,
Okay.
where it joins Yang Chao Mai to go overhead.
Okay, very good. Join pa rin sila. What are the points that we use for Yin Chao Mai, which you may find very effective, no? For yung mga minention mo na symptoms.
Kidney 6, kidney 8, bladder 1, GB20, and Do16.
Okay. Remember, kung walang nangyayari sa pasyente, you might want to use these points already. Okay? Now let's go to the... Okay, what if you use both Ren Mai and Yin Chao Mai pairing? Ano yung mga issues na pwede
Mas powerful siya dun sa mga kanina na yung
Okay.
yung symptoms.
Yes. So the abdomen, the chest, lung, throat, face, yin problems with disordered fluid metabolism. Yung mga hindi na natutulog, tapos nakadilat na lang, di ba? At the same time, manas yung paa, no? Next, let's talk about the Chong Mai. Tell us more about it. Ano another name for Chong Mai?
first channel or penetrating vessel.
Yeah, it is the
First
first
channel
channel that
develop
developed in an embryo.
embryo.
Something to remember, huh? The first channel, kaya don't ignore this, especially among women. Next,
Mm,
Chong Mai is paired with,
yin wei mai.
very good. What is the Chong Mai master point?
Spleen 4.
Coupled point of Chong Mai.
Pericardium 6.
Very good. What are the functions of Chong Mai? What is it commonly called?
It is called the sea of blood. It allows for uninhibited circulation of blood throughout the body. The sea of 12 meridians flushes qi and blood through main meridians.
Mhm.
It nourishes the 5 viscera, yin and 6 yang bowels. It is involved in both physical and spiritual heart functions, connects pre and postnatal chi, governs menstruation and sexual characteristics with renmai, governs reproduction, nourishes the fetus, circulates chi in the abdomen, affects digestion, chest, heart, and large intestine for nutrients absorption.
Ang dami, no? Ang dami.
Kaya sea of blood.
If I were you, you try using that on the ear. Yung Chong Mai master point and the coupled point, no?
Masubukan nga po.
Ay, nako, ang ganda. Next, symptoms po ng Chong Mai.
Disorders of blood, including stasis and vacuity. Symptoms focus on upper abdomen, gynecological conditions, menstrual and gynecological, male genitourinary,
Genitourinarian. Yeah.
genitourinary and sexual problems, stagnation in the abdomen, masses, rebellious chi, disorders of the GI tract, heart pain.
Okay. Pathway of the Chong Mai.
There are 5 paths. One first begins in the internally in lower abdomen down to REN 1, where it becomes external. Stomach 30, kidney 11, 12, 13, 14, 15, REN 7, kidney 16, 17, 18, 19, 20, 21, up to disperse in the chest. All the remaining paths are internal.
Okay.
Path begins in the chest where the number 1 dispersed runs up the face, encircles mouth and ends up in the nasal cavity.
Okay.
3
Number 3.
runs to QI thoroughfare, the medial aspect of thigh, leg posterior to medial malleolus to sole of the foot. 4 follows spleen channel down medial thigh, medial leg, medial foot to great toe. 5 path begins in lower abdomen and travels up the spine to upper back.
Okay. Very good. What are the points that we use for Chong Mai?
REN 1, stomach 30, kidney 11, 12, 13, 14, 15. REN 7, REN 17, kidney 16, 17, 18, 19, 20, 21.
Okay, this is a very good guide, no? Andito na lahat, to. Memorizing na lang yung mga points. You can choose any of the points there. Next, let's compare Chong Mai with Ren Mai. Ano yung pagkakaiba? Puro sila yin.
Chong Mai is rebellious chi, blood disorders, upper abdomen element of spleen stomach pathology, upper burner symptoms of heart and pericardium.
Mm-hmm.
Compared to Renmai, chi disorder, lower abdomen, kidney lung pathology, yin vacuity, upper burner symptoms of the lung, urinary symptoms.
Okay. So, if you want to put it simply, no, pag Chong Mai, something to do with yung mga GERD, no? Blood
Oh,
disorders, upper. Kaya dapat broad talaga yung pagtingin mo ng pasyente, no? Renmai, chi disorder, kidney lung pathology, ibig sabihin medyo maedad na konti, no? And yun. Next, Yin Wei Mai is
the yin linking vessel,
Yin Wei Mai is paired with
Chong Mai,
master point of Yin Wei Mai,
pericardium 6,
coupled point of Yin Wei Mai,
spleen 4,
Shi cleft point of Yin Wei Mai.
kidney 9.
Very good. Functions of Yin Wei Mai.
Link respective yin and yang meridians together, bind and strengthen the mind and body, provide structure, psychological support, connects all yin channels, balances the emotions, reinforces, regulates, and balances energy and activity in yin channels, reinforces blood and the heart.
So medyo psychological, di ba? Oo. So
Ito pala,
yes, yung mga may psychological issues. Kaya ang dami ng nasisiraan ng bait ngayon, so dapat gamit-gamitin. Di ba? PC6 and SP4. What are the symptoms of Yin Wei Mai?
symptoms are heart, chest, stomach disorders, emotional disorders, used to open the chest, weakness and limpness of body, together with insecurity and mental disturbance, blood and or yin deficiency, especially if accompanied by psychological symptoms
Fine.
like anxiety, restlessness, insomnia. So it also calms the mind and maybe an answer to broken heart,
Yes.
chest tightness and pain,
Yeah.
cardiac discomfort, plump sensation, blood deficiency,
Headache.
headache at the back of the neck. When the yin and yang wei mai cannot maintain their respective ties, one feels uncomfortable and loses one's will. Furthermore, one is flaccid and cannot support one's stature. Hirap tumayo.
Okay. Broken heart, Yin Wei Mai.
Pag walang forever.
Walang forever. Hanap ulit ng iba. Let's go to the pathway of Yin Wei Mai. Number 1.
Number 1, pathway begins on medial aspect of the leg, travels up to the abdomen, chest, and disperses in the throat.
Okay.
Uy, 90 na pala.
90 na, tapos na. Thank you so much, Sir Victor. Punta naman, magtampo
Salamat.
si Ma'am Erdeles. Good afternoon
Hindi.
po.
Good afternoon po, Doc. Hindi naman po magtatampo, Doc. Dapat
Okay.
inapos na ng cervix eh.
Punta na tayo sa points. Andito lang po ang points, oh.
Opo, 91 po.
Yes, 91. Points
Kidney
na.
9, kidney 9, spleen 12, spleen 13, spleen 15, spleen 16, liver 14, ren 22, and ren 23.
Okay. Ganda ng ating illustration, di ba? We'll send that later. Okay. Ano difference ng Chong Mai sa Yin Wei Mai?
Chong Mai is inner legs, abdomen, chest, heart, stomach, and reproduction. The Yin Wei Mai, organic insufficiencies with hereditary background.
Okay. Yeah, so there. Easy, no? Next, ano po ang tawag sa daimai?
Belt girdling vessel.
And daimai is paired with what?
Yang Wei Mai.
Daimai is coupled with? Yung
Sanjiao 5.
Very good. Daimai master point?
Gall Bladder 41.
Functions of daimai?
Functions are only horizontal channel in the body, binds channel at the waist and running up the trunk, regulates balance between upward and downward flow of qi in body, encircles the leg channels and affects their circulation, controls genitalia, waist, and hips, affects circulation of qi in stomach, controls the muscles that support the abdomen and lower back, waist, and hips, links the yin meridian on the front of the abdomen with yang meridians on the back, controls the qiao-yang meridians.
The symptoms of daimai?
Weakness and sagging in the lumbar and lower abdomen, tightness of the lumbar and lower abdomen, disorders that combine excess above with deficiency below, cold, damp, and vacuity disorders of the lower body or leukorrhea, sitting in cold water, dysmenorrhea, uterine prolapse, ovarian cyst, hip arthritis, upward rising yang, disturbances of the upper body, paralysis, hemiplegia, disorders of motor nerves, lower extremity spasms, coldness, paralysis, prolapse, miscarriage, headache, especially in women with lower abdominal congestion.
Pathway of the daimai?
From L2, it encircles the waist.
Okay, kaya para siyang belt, no? Excess above, deficiency below. Minsan yung magtataka ka kapat mapula, mainit sa taas, yung paa niya malamig. So that's you have to do the daimai. Points of the daimai?
GB 26, 27, 28. Some sources do 4, bladder 23, bladder 52, spleen 15, and stomach 28. The kidney connection.
Okay. Yang Wei Mai is also known as?
Yang linking vessel.
Yang Wei Mai is paired with?
Daimai.
Master point of Yang Wei Mai?
Sanjiao 5.
Coupled point of Yang Wei Mai?
GB 41.
She cleft point of Yang Wei Mai?
GB 35.
Function of Yang Wei Mai?
It connects all yang channels, reinforces, regulates, and balances energy and activity in yang channels, link respective yin and yang meridians together, bind and strengthen the mind body, provides structure, psychological support, affects sides of the body.
Symptoms of Yang Wei Mai?
Begins anterior to the lateral malleolus.
Uy, ano yan?
Up
Pathway?
Ha?
Symptoms ang ano natin.
Wait lang. Ito pala. Weakness and limpness of body together with insecurity and mental disturbance, intermittent fevers and alternating fever and chills, pain in lateral side of the body, when the yin and yang Wei Mai cannot maintain their respective ties, one feels uncomfortable and loses one's will. Furthermore, one is flaccid and cannot support one's future, according to Nanjing.
Pathway of the Yang Wei Mai. Natapos na tayo. Go.
Begins anterior to the lateral malleolus. Inferior to the lateral malleolus. Up lateral lower extremity. Up posterolateral trunk. Posterior to shoulder. Up neck and lateral head to forehead. Back up over the top of head to the nape of neck.
Okay. And finally, the points for Yang Wei Mai.
Bladder 63, GB35, SI10. Ano yung TW, Doc?
Triple warmer.
Triple warmer
Triple
15,
burner, yes.
GB13 and 21, Do
220.
16,
Yeah.
Do 16, Do 15, and stomach 8.
GB13 to 21 yan. Tuloy-tuloy. Okay,
Okay po.
comparison po ng Dai Mai and Yang Wei Mai.
Yang Wei Mai is an outer leg, sides of the body, shoulders, sides of the neck. Dai Mai, migraines with menstrual disorders.
Okay, very good.
Thank you po.
Sir Mary Angeli, did you get everything? Sir Victor and also Ma'am Erdeles?
Thank you po.
Yes, Doc.
Okay, actually this is not commonly done, but let's try to do it if you don't if you can't do anything about the patient anymore, no? Interesting, di ba? You might want to use pinaka-importante lang dito yung mga opening or master point and the coupled point. Okay? So thank you so much for joining. Congratulations. Malapit na tayo matapos. Pahinga tayo ng 2 weeks. And can we meet again on Tuesday?
Yes po, Doc.
For the last one, 5 phases naman yon. Doktora, thank you so much. Ma'am
Thanks,
Erdeles,
Doc.
Sir
Thank you
Victor.
po.
Sadly, si naka-mobile, nagta-travel paakyat na daw si Dr. Janine. But anyway, thank you so much, everyone. You are so good. Marami ba kayo natutunan today?
Yes po,
Yes
kasama
po, Doc.
tools natin.
So I'll try to edit our answer key para we can have a very good reference. Andun na lahat, no? And we try to make it look very simple para lahat matuwa. Maraming salamat po, everyone. See you
Thank you
again
po, Doc.
Thank you, Doc.
Tuesday.
God bless po,
Thank you
Doc.
po. God
Good night.
bless and congratulations. Good night po.